As part of the Ehsaas strategy, we achieved a historical landmark earlier this year to conclude the Ehsaas National Socio-economic Registry survey for 34 million households. And today I would like to share some of the key insights from the data collected and how it has enabled us in the successful delivery of Ehsaas program. But before we go to that section, I would like to set up the context by giving you a quick introduction of the Ehsaas National Socio-economic Registry. What was the process followed to complete the registry, and more importantly, what makes the Ehsaas registry unique and important. We will then deep dive into insights collected from the survey across multiple dimensions before we conclude by discussing evolution of the registry and the way forward. The Ehsaas survey is an all-encompassing survey designed to assess the socioeconomic status of households and ascertain their poverty score through proxy means testing. The survey has 43 unique variables and covers demographic, socioeconomic, education, health, and asset profiles of households. During the Ehsaas survey, a special emphasis was placed on the transparency and quality of data collected. A digital methodology was outlined with end-to-end process automation and digitization. To complement this, multiple logical checks, validations, and data analytics were factored in at various phases as well. You can find more details about the survey process in the documentary, which can be accessed through the URL mentioned on the screen. I would now like to focus on what makes the Ehsaas registry unique and how it is different from the previous 2010 survey conducted by BISP. The registry is unique and important for 4 reasons. First, because it is not just Pakistan's but also South Asia's first digital door-to-door census-like survey. Data is the backbone of decision-making, and its relevance for social protection operations is critical because it is only through credible data that you can make evidence-based impartial decisions. The Ehsaas registry is the backbone on which all targeting decisions are made. In Ehsaas Kafalat, in Ehsaas school stipends, in Ehsaas Nasho-Numa, Ehsaas emergency cash, Ehsaas Amdan, Ehsaas Ration Riayat, and other Ehsaas initiatives. Surveys conducted in the past were fraught with challenges owing to their being paper-based. Without inherent controls, they became controversial. In the Ehsaas survey, multiple digital safeguards and checks were built in to hedge against abuse. Data collection was done through the computer-assisted personal interviewing approach. To hedge against errors and abuse, a 6-tier system was developed. Processes were automated end-to-end. Houses were digitally listed, so enumerators actually had to go on-site and couldn't fill a form sitting in a hujra to curry favors. The interview form had inherent logical checks when it was filled in an online mode, and a layer of supervisory oversight when filled offline. Third-party validations followed after a survey batch was cleared. Then came the process of data validations for some of the demographic variables. And finally, data profiling was done against wealth proxies using the CNIC as the peg before eligible lists are prepared. The second reason why Ehsaas's National Socio-economic Registry is important is because it enabled the federal government to move towards a new paradigm of giving subsidies, moving away from untargeted to targeted subsidies. The newly launched Ehsaas Ration Riayat, which is a program to deliver targeted subsidies, is also drawing on these data. Third, rather than being a static registry, the 2021 Ehsaas registry is a dynamic, adaptive, and shock-responsive registry. A more detailed account on the dynamic registry is included towards the end of this video. In the fourth place, the registry is a critical foundation of the data management mechanism established under the One Window Ehsaas architecture. Data sharing and data access services are enabled through the cognitive API architecture approach. Ehsaas implementing organizations and provinces are now able to access data through APIs for free. Data sharing for the Ehsaas Ration Riayat program has already been enabled through this approach. Previously, the 2010 BISP data was siloed. Even provincial social protection agencies had to do extensive paperwork to access data, and there were significant costs involved. Agencies connecting to the Ehsaas database through APIs will also be required to share data back, and in this way, the 2021 Ehsaas registry will be significantly enriched over time. I would now like to share some of the data insights from the survey completed. Specifically, I would like to share key insights across 4 dimensions: household coverage, socioeconomic analysis, education analysis, health and disability analysis. These insights from the survey have enabled us to design and redesign programs under the Ehsaas umbrella and make targeted and focused interventions on the basis of merit and need. This slide shows the total number of households covered in the Ehsaas survey vis-a-vis the households registered in the national census across provinces. Overall, the Ehsaas survey was completed for 104% of the households, with highest coverage reported in AJK and lowest coverage reported in Punjab. The dashboard also gives us the flexibility to apply different data filters and drill down on the preferred data set. For instance, in Sindh, we conducted survey for 9.7 million households and covered 113% of the total population reported in the national census. This slide shows the average household size by different socioeconomic classes. The bottom quintile has the largest household size of 8.3 members, with an inverse relationship in household size with increase in the PMT score. This shows that family planning efforts need to be concentrated at the bottom quintile more than the others. The dashboard also gives us the flexibility to apply different data filters and drill down on the preferred data set. For instance, the household size for households with PMT less than 26 in Bonaire district of KP is 10.9, which exceeds both provincial and national averages. This slide shows the number of households at or below the Kafalat threshold of assistance. Overall, 31.9% of households in Pakistan are at or below the Kafalat threshold, with a noticeable difference across provinces. For instance, in Balochistan, 40% of households are at or below the Kafalat threshold, whereas in Islamabad, the number is below 5%. The bottom half of the slide further drills down on the number of households at or below the Kafalat threshold of poverty assistance at a district level. There is a significant polarity of Ehsaas Kafalat households reported across districts. For instance, in Rajanpur, 63% of households are at or below the Ehsaas Kafalat threshold, whereas in Islamabad, the same number is below 5%. The dashboard also gives us the flexibility to apply different data filters and drill down on the preferred data set. For instance, in Gilgit-Baltistan, 33% of the households are at or below the Ehsaas Kafalat threshold, with a visible variation across different districts. 62% in Diamir versus only 11% in Hunza. The next section is the socioeconomic analysis, and we will start with the type of housing structure. This slide shows the distribution of households by type of housing structure, that is whether kacha or pakka. In Islamabad, more than 80% of the households are pakka, whereas in Balochistan, only 12% of the households are reported as pakka. A similar variation can also be observed at a district level. In Karachi South, 92% of the households are pakka, whereas in Ganche district of Gilgit-Baltistan, this number is staggeringly low at below 0.5%. This slide shows the total workforce between 14 to 60 years of age reported as part of workforce across different provinces and districts. For instance, Sindh has the highest number of people reporting themselves as part of the workforce, whereas in KPK this number drops significantly to 22%. At a district level, Lehri district of Balochistan has the highest number of self-reported workforce, 58.5%, whereas in Kila Saifullah district of Balochistan, this number is below 15%. The dashboard also gives us the flexibility to apply different data filters and drill down on the preferred data set. For instance, in GB, 25% of the population reported themselves as part of the workforce, with the visible variation across different districts. 34.8% in Hunza versus only 20% in Diamir. This slide shows the split of workforce by provinces. Punjab, being the most populous province, reports over 52% of the total workforce in the country. The bottom half of the page shows the employment data by district. Nasirabad district of Balochistan has the highest employment rate at 83%, whereas in Washuk district of Balochistan, employment rate is just over 2.5%. We further analyze the workforce by gender in provinces. Across all provinces, Islamabad reports the highest number of people reported themselves as part of the workforce. which is 43%, whereas in Balochistan only 19% classified themselves as part of the workforce. In terms of the gender split, more male reported themselves as part of the workforce compared to females across all districts of Pakistan. From a livestock point of view, 37% households in GB reported to have livestock, whereas this number is just 1% in Islamabad due to the strong urban population density. At a district level, 81.5% households in Tharparkar reported to have livestock, whereas this number drops significantly for Karachi, where less than 1% households have livestock. On households with open defecation, there is a stark difference across provinces in Pakistan. In Qilla Saifullah, close to 80% households reported open defecation, whereas in Gujranwala, only 1.2% reported as such. In terms of access to electricity, 84% households across Pakistan have access to electricity, with a noticeable difference across provinces. For instance, in Punjab, 92% of the households have access to electricity, whereas in AJK, only 46% of households have this facility. Similarly, at a district level in Karachi South, almost all households have access to electricity, 99.1%, whereas in Avaran, only 0.3% households reported to have access to electricity. This is a stark disparity. In terms of access to clean water, 87% households across Pakistan have access to clean water, with a noticeable difference across provinces and districts. For instance, in GB, 92% of the households have access to clean water, whereas in Sindh, only 59% report access to clean water. Similarly, at a district level in Muzaffargarh, 99.2% have access to clean water, whereas in Ziyarat, only 16.7% households reported to have access. The next section is the education analysis, and we will start with the out-of-school children. In Pakistan, 35% of children are reported out of school, with a noticeable difference across provinces. For instance, in AJK, only 16% of children are reported to be out of school, but in Balochistan, this number goes up significantly to 61%. We further drill down on the number of children reported out of school and analyze them at a district level. There is a noticeable difference of out-of-school children across different districts. For instance, in Sajawal district of Sindh, 86% of children are reported out of school, whereas in Hunza, this number is only 3%. This clearly has a policy implication. So a drill down of these data will clearly show areas where a concentrated policy effort is required to bring children out of school. In terms of the gender split of children reported out of school, females across all provinces have slightly higher ratio of being out of school, which is why in the Ehsaas ecosystem, in the Ehsaas policy framework, the stipend policy in the education cash transfer program, Ehsaas Talimi Wazaif, the stipend policy was skewed to favor the girl child. Girls in Ehsaas school stipend got a higher stipend amount, and also when they graduated out of the 5th grade, they were given a bonus to encourage families to send children to school. We continue our education analysis and look at literacy rates. In Pakistan, 44% of people above 10 years of age reported to be literate, with a noticeable difference across provinces. For instance, in AJK, highest literacy was reported at 73%. On the contrary, Balochistan has a 24% literacy rate. The similar trend can also be observed at a district level. For instance, in Hunza, a district of GB, 84% of the population is reported to be literate, whereas only 9% is reported to be literate in Dera Bukti in Balochistan. The last section is the health and disability analysis. The self-reported prevalence of chronic diseases across provinces shows interesting insights. GB has the highest percentage of households affected by chronic diseases, at 66%, whereas in Sindh this number is significantly lower, 27%. Similarly, at the district level, 91.1% of households in Gizar district of GB reported prevalence of chronic diseases, compared to only 10% in Tharparkar in Sindh. Since these are self-reported data, the level of awareness can have a huge impact on the reporting of disease, and therefore these data should be viewed in the context of that consideration. In terms of prevalence of chronic disease at the household level, cardiovascular is the most prevalent disease, with 19% households reporting it. Diabetes and hepatitis C are the second and the third most prevalent diseases, respectively, in households. Moving on to the health and disability analysis, the percentage of households in Pakistan reported to have at least one disability is approximately 4.5%, with a noticeable difference across provinces. For instance, in Balochistan, 8% plus of the households reported at least one disabled, whereas for the other provinces, the disability reporting ranges between 4 to 5%. A similar trend can also be observed at a district level. For instance, in Shirani, close to 9% of households reported prevalence of disability, whereas prevalence in Sialkot is reported at 1.7%. In terms of disability profiling, lower limb is the most commonly reported disability amongst the population. Mental disability and visual disability are the second and the third most commonly reported disability, respectively. In terms of stillbirth and infant deaths reported in the last 12 months, GB reported the highest number of households affected by this, 4.8%. On the contrary, in Punjab, only 1.4% of the households reported the same issue. Similarly, at the district level, Harnai district of Balochistan reported 8.4% of stillbirths infants, whereas the number is just above 1% in Gujranwala. The last portion of this document focuses on the future of the Ehsaas National Socio-economic Registry and its full evolution towards a dynamic registry. The development of a data registry through door-to-door survey is an operationally cumbersome, time-consuming and a costly process. And that's why it was just the second time in the history of Pakistan that a nationwide socioeconomic survey has been completed. Not just that, the data registry also needs to be updated regularly to avoid exclusion and inclusion errors and to enable the government to effectively target social protection benefits. According to global standards and the assessment of academics, the data registry gets outdated in 4 to 6 years' time. The socioeconomic conditions, geographic mobility, and demographic status of households evolve over time. Some households graduate out of poverty, while others are further pushed down the line. To update the Ehsaas registry on a regular basis and to avoid inherent limitations of a door-to-door survey, the 2021 Ehsaas registry is designed to be dynamic, adaptive, and shock responsive. After introduction of this dynamic approach and its features of on-demand registration, there will be no further requirements for carrying out door-to-door activity at the national scale, and people can apply for programs when they are in need through any of the 500 plus Ehsaas registration centers established nationwide. I would like to walk you through the process cycle of making a registry dynamic. The process outlines 7 different types of interventions, which start with the completion of the door-to-door survey and end with the updated registry. Type 1 intervention is updating missing information from the national door-to-door survey. During this survey, some households might have been missed and others might have been provided partial and incomplete information or have some other data discrepancies. Through this type of intervention, missed out households and households with certain discrepancies have an opportunity to register and update the information by visiting any Ehsaas registration center. And today, more than 500 plus Ehsaas registration centers are doing precisely this. The second intervention is the implementation of an appeals cutoff. This type of intervention is designed for vulnerable households who have marginally missed out to become Ehsaas program benefits. That is, their PMT score is slightly above the PMT cutoff set for the Ehsaas program. The key vulnerabilities include presence of 1 or more widows, presence of 1 or more members with 65 years of age, and household size of 3 or less members. The mechanism to implement this intervention has been developed, and the intervention can be implemented subject to the availability of budget, which we did not have in the 2021-22 budget, but all plans have been completed and a formal decision needs to be now taken with regard to budget allocation. We were hoping to do that in the 2022-23 cycle. Type 3 intervention is the update in the beneficiaries roster. The roster update is an ongoing intervention which is being done across all Ehsaas registration centers in the country. Through this intervention, beneficiaries can visit any Ehsaas registration center to reflect demographic changes in their households and update their roster information. The key demographic changes include birth registration, death registration, marital status update, gender update, and disability update. The Type 4 intervention is a shock-responsive update. This intervention is exclusively available for households affected by any disaster or natural calamity. In case of a shock or disaster, households residing in the affected areas are allowed for another survey intake to reflect their updated socioeconomic status. The new PMT score is calculated based on the revised survey, and eligibility is determined on the basis of the new score. For instance, this exercise was recently undertaken in Tira, where IDPs returned back after 12 years. And I personally visited Tira to kick off this activity, updating the particulars of families in the National Socio-economic Registry. Type 5 is a cyclical socio-economic update. Under this intervention, people currently not entitled to any Ehsaas benefits will be called to their nearest Ehsaas registration centers after 2 years from the date of their initial survey to update their socioeconomic status. And we were planning this for 2024. Through this exercise, the revised PMT will be calculated based on the updated information provided, and additional households will be enrolled as Ehsaas beneficiaries if their revised PMT is below the threshold set for Ehsaas programs. We had planned calling people on a staggered basis in 2024 on the basis of their PMT score, and to complete the process within a year. And then this would be a cyclical process from there on, every 2 years. Type 6 is a recertification of beneficiaries, and under this intervention, the existing Ehsaas beneficiaries would be asked to go through a mandatory recertification after 3 years from the date of their eligibility of this program. It would be mandatory for all existing eligible beneficiaries to report at the desks to recertify their socioeconomic status within 6 months starting from the date of the announcement. And we were hoping to kickstart this in 2024 as well. A recertified household still falling within the determined program eligibility criteria would continue receiving Ehsaas benefits, and households falling above the determined eligibility thresholds would be exited from the program. This was our plan. Benefits of households not participating in recertification process we planned would be suspended after 6 months and would remain suspended till their recertification. After the completion of the cyclic socioeconomic update for non-beneficiaries and recertification of existing beneficiaries, the Ehsaas database would be updated and overall registry would then be launched again. With the introduction of this dynamic approach, there will be no further requirements for carrying out door-to-door activity at a national scale, and the registry can also be updated on a more frequent basis in a much more sustainable and cost-effective manner. The Ehsaas registry, along with the Ehsaas one-window service delivery system, is one of the vital pillars of the Ehsaas vision, which aims to provide social protection to all who need it in Pakistan. I hope Ehsaas will continue and will be further expanded. This is vital not just for the millions of households who benefit from it, but also for Pakistan's image in the international community, where Ehsaas is widely regarded as unique and cutting-edge social protection.